Chief Medical Correspondent Dr. Jon LaPook joins us now. And John, good to see you. The Surgeon General is warning that this week it is going to be bad. What exactly should America prepare for?
Well, I think we should prepare for understanding that we have to flatten that curve, right? If there are more and more cases happening, we have to buy in to the fact that when people do the social distancing, when they do the hand washing properly, they're actually making a difference.
We've heard stories of doctors over-prescribing drugs like hydroxychloroquine, which could be a possible treatment for COVID-19. Why is this so dangerous?
I feel so strongly about this, Nora. I understand the instinct to have it just in case, but when it's sitting there in your medicine cabinet unused, guess what? The people who actually need it may not be able to get it, and that's actually happening where people who have lupus, rheumatoid arthritis, where it's been proven to work, they're not able to get it.
And so we're now halfway through the federal guidelines to slow the spread, this social distancing. Are we seeing any progress?
You know, Nora, it's really hard to know because, again, there's not enough testing right now, and we're still waiting for a very important test that we haven't spoken a lot about. What they're working on now is an antibody test to see if you had infection. Once we know what those are showing for big populations, we'll say, oh, you know, maybe it turns out that a lot more people were infected and immune than we realize, and then we're going to be able to get a sense of where this thing might be headed.
As we near the deadline of those federal guidelines, at the same time, you hear the governor of New York saying today we need to start talking about reviving the economy and sending some people back to work. How will public health officials react to that?
I heard that, and as a physician, they do brush up against each other. Because think about it, if you find out that somebody has immunity, those could be the exact people who go back to the front lines, go back to work.
What's the guidance about being outdoors?
Yes, you can go outside. Yes, you have to be careful. You know, you have to use your head about it. But personally, and also as a physician, I think it's good for your physical health, it's good for your mental health, and guess what? If your anxiety goes down, that helps you get to sleep better, and guess what happens during sleep? Your immunity gets repaired.
And we all want to keep our immunity way up. Thank you, Dr. Jon LaPook.